H. pylori and ulcer disease are quite common in our society, somewhat more prevalent in underdeveloped or third world countries because of hygiene factors whereby this bacteria called the Helicobacter pylori can be easily transferred from food, soil, into the body of an individual. It doesn't have to be a patient initially because most patients can be totally symptom-free. We use the term asymptomatic and yet harbor this bacteria in the lining of the stomach for many years before some symptoms, some illnesses develop as a result of this festering, ongoing low-grade infection. H. pylori, therefore, plays a role in the development of inflammation of the lining of the stomach. That is called gastritis. In addition to that inflammation, the lining can be altered further, damaged further, and then ulcers form. An ulcer is like, if you will, a burn, not truly a burn in that term, but something is being dug out of the lining, so there is a crater. And that is what we use to say there is an ulcer there. Gastritis, the inflammation, the lining is reddish, but there's no crater. Now, these ulcers don't only have to develop in the stomach, they also develop in the duodenum, or duodenum as called by other physicians. So patients can have duodenal and gastric ulcers. Now, it's important to add that not all ulcers in today's environment are caused by the H. pylori bacteria. It may well be that most of them, or a large percentage of patients who have ulcers are the end result of taking drugs, what commonly are called nonsteroidals, aspirin, even the coated ones, Bufferin, Motrin, Advil, Aleve, and so on. And these drugs injure the lining. Now, if on top of that insult, as I will call it at this time, there is an H. pylori infection, then more likely than not, these changes will occur, and they may be more significant with deeper ulcers or a greater number of ulcers. Now, normal individuals develop this. Patients don't have to be sick to acquire an H. pylori infection. You can have ulcers and H. pylori with minimal symptoms. When patients develop symptoms of ulcer disease, which may also be related to the development of having had the bacteria for years and have gastritis, they will have pain, discomfort after eating, nausea. Some patients lose weight. Some patients, as a result of these ulcers having formed, have been there for a while, call it chronic rather than just acute, can present with bleeding, black stools, or vomiting blood, in addition to the other symptoms that I just stated. Now, the reason why it is important to screen for H. pylori in that setting is that in a small percent of patients, H. pylori bacteria can be a precancerous risk factor. So if there's a chronic infection with a chronic gastritis, this can, over time, many, many years, allow the lining of the stomach to change over to a precancerous state. And there are different changes that are seen under the microscope that lead to this. Ulcers of this nature are quite common, as I said before, in all our countries, our environments, here in the United States, but also in underdeveloped countries. And it's very easy to detect. You can detect it by doing special tests. Some people will check for the H. pylori, physicians obviously, in the stool. If it's there, it's a positive result. The blood tests are not that specific because you may have been exposed to an H. pylori infection many years ago. Your blood is positive, but you may not have active infection at this time. So there are other tests which are non-invasive. We call them breath tests, where you drink something that's usually sweet, and then you breathe into a little bag. And if there's H. pylori that's alive in your stomach, something is released from that sweet mixture that the patient swallowed, and then it's measured in the bag. And if there's an increased release of that something, that tells us that there's active infection with H. pylori bacteria. Ultimately, if you suspect ulcers or the patient's not getting better, then the final test to exclude ulcer disease or bad gastritis, significant gastritis, is to do an endoscopy with a little light. Patient swallows the instrument, very simple, some mild sedation, a topical anesthetic to minimize any nausea. And then you look at the lining of the stomach and duodenum, see what's there. If there's no ulcers and you see some evidence of mild gastritis or more significant gastritis, biopsies are taken. These will be studied under the microscope immediately. They will be tested for the H. pylori. So there's a spectrum of disease that occurs in this setting. H. pylori can occur in very young individuals, including children, and also in elderly individuals as well. So therefore, it's very common. It should be looked for.